Hi, welcome to Capital Smiledocs YouTube channel. I'm Dr. William Vu, and today's topic is on children's orthodontics. Children's orthodontics is about getting a better bite for your child. It's not just about aligning the teeth, but also making the teeth fit together. When a bite is off, what happens is that creates interferences when the child bites down. And what happens is that the child will shift their jaw to one side to try to make the crooked teeth fit together. What happens is that it leads to a strain in the jaw muscles and lead to TMJ problems down the road and pain and other problems that can occur. With children's orthodontics, there are many options these days, and the best treatment for your child starts with doing the diagnostic phase. What we would do is we would take impressions of the dentition, the upper and lower jaw, so that we can study to see how the teeth fits together. We'd also take a specific x-rays to see the angulation of the teeth, the root formation of the teeth, and when best to start orthodontic treatment. We would also take a specific x-ray called Ceph x-ray, where we're able to look at the jaw relationship compare the upper and lower jaw with each other. And the best time to do interceptor orthodontics is before the growth spurt. And the reason being is that if we're able to correct a malocclusion or an improper bite that's forming early on before the growth spurt, then while the child's growing through their growth spurt, we can modify jaw growth and improve the alignment of the jaws with each other. This means that you get a better result. It's much quicker to straighten the teeth and get a proper bite compared to an adult, and there's less chance of having extractions done and a more serious jaw surgery when they're an adult. Whereas once they're finished growing, we can only move teeth around, we cannot modify jaw growth. What happens is that the treatment is more complicated, it takes more time, it costs more because of the increase in time duration of treatment. There's more chance of extractions, and as well as there's more chance of more complex surgery to modify jaw growth at that time. So the best time to bring in a child is before the growth spurts. Females or girls typically start the growth spurt anywhere in the range between 10 to 14 years of age, and of course we're all different, so there is a wide range of age, whereas boys, they're usually delayed by about 1 to 2 years. So if you do see that your child's developing an improper bite, the best thing to do is discuss it with a dentist and then get an assessment to see what's best for you. If you want to learn more about children's orthodontics, check out capitalsmiledocs.com or call us for a consultation. Thank you. Hi, welcome to Capital Smiledocs Dental YouTube channel. I'm Dr. William Vu, and this video's topic is on adult orthodontics. Did you know that according to the Ontario Dental Association, 30% of patients who are undergoing orthodontic care are adults? Adults these days are undergoing more and more orthodontics because they realize that they too can have the smile that they have always wanted. There are many benefits to having orthodontics or braces as an adult. 1, it helps to improve your appearance. 2, it increases your self-esteem when you're doing face-to-face interactions with other people, but there's also a health benefit. When the teeth are crowded and there's not enough room for them, what happens is that teeth will overlap each other and create these nooks and crannies that are hard to keep clean, and it creates a food trap and a bacteria trap. So people who have crowded teeth, studies do show that they are at a high risk of getting gum disease and periodontal disease, which is a bone disease. With orthodontic treatments for adults these days, there are a lot of options. They range from the traditional braces to the ceramic braces, which are clear and non-metal, and there are the Invisaligns as well. Now each one of these options have their own specific indication to them, and the best thing is to see a dentist to have an assessment. With orthodontics, what we would do is the first appointment we would do an assessment. We would take records of your dentition, we would take impressions so that we can study how your bite is in relation to the upper and lower teeth, as well as we're going to take additional x-rays so that we can have a look at the root angulation of your teeth in relation to each other, as well as your skeletal or your bone jaw relationship with the upper jaw compared to the lower jaw. Now with orthodontics, we are not just straightening teeth, but we're also improving the bite. When a bite is off, the teeth do not fit together well, and what happens is that when you bite down on these crooked teeth, it creates interferences. With interferences, it will cause what's called a functional shift, where your jaw will shift to one side to try to make your crooked teeth fit better. And the shifting, or the functional shift, what we call it, will cause strain to your jaw muscles and then lead to TMJ problems and other health concerns. So we're looking at achieving a better bite and also making the upper jaw and the lower jaw fit together better. So sometimes you could have skeletal problems where the upper jaw is not in proportional size to lower jaw. So we take all this into consideration, and then we would come up with a treatment plan. We would sit down with you, go over the details as to how long the appointment would be, what's involved, and answer any questions that you have. So if you have any questions, check us out on capitalsmiledocs.com to find out more about orthodontics.